I'm Dr. Miner, and today we are here with Heather, and we are going to demonstrate one of the things that we do to address joint pain here. And Heather had a little accident, I guess you could say, or a little trauma a few weeks ago. Tell us about that.
I worked with kids, and I was helping a student, and she bumped and hit my jaw, and I'm here hoping to help with inflammation.
All right, so as Heather said, we're going to address inflammation in the joint that was created from that trauma. And what we do differently, right, because most dentists, right, they're going to make some kind of splint like this, right, because that's what they know, right? It could be bigger, it could be smaller, right, but then the person wears it. Really, but in this situation, this isn't going to do a whole lot for her situation. So we are going to do what we call low-level laser therapy. And we have done one session already. And tell us what you noticed with that.
Well, during the procedure, it was really warm, which is nice. And then later on the evening, there was some soreness, and I just took a warm pack, put it there. Tuesday, woke up, and everything felt fine.
All right, great. And that's pretty typical with the laser, right? So the laser feels warm, but it's not the warmth that is doing the therapy. It's actually the laser light and the laser energy that's going into the tissue that's doing its thing. And there is typically a delay with how it feels afterwards. Typically it's going to be 12 to 24 hours, right, before we notice anything. And so we're going to do a few more sessions, right? For this to really work well, it's done in sessions, and we space those with that, and we'll get a good result. So I'm going to take the laser over this area, and there's a dose we're going to use. We can calculate the dose of the laser that we're going to put in here, and we're going to do a healing dose with this. So that's going to reduce the inflammation in there, stimulate this to heal, and eventually we'll reduce that soreness that's going on. We got done with that, and how'd that seem?
It seemed great. Seemed fine. Not as hot and not at all unbearable. It's very comfortable.
Yeah, so we changed our dose on this. So we lowered our dose because we want a different mechanism happening from last time. And again, this is something, you can say, a really easy treatment, for this joint pain that can be done. Where again, you don't need to do the splint every single time. But this is going to help with that healing,